Hello, I'm Christine Schiavone, and our show is Spiritual Exploration. Tonight I have with me a special guest, Christopher Dowling, and he is the head of a new program to help our neighbors through a health equity program.
I'm an advisor, consultant,
You're
and
the
helping run
advisor
it.
consultant. And we would like to talk about this because the aim of this particular show is to help others, which is a very spiritual thing to do. And I like the idea of helping people. I really do, because there's a lot of people out there that need help, and they need to be given what they need to survive and to be healthier and to live longer and everything. And I'm going to ask you now, Christopher, to tell us about it.
Sure. Thank you, Christine, for having me here tonight.
My pleasure.
And I think it's so important that we make sure that our community, and this is a statewide program, that people know about it because it could impact millions of lives throughout the state. In Staten Island alone, it could impact well over 100,000 people.
Wow.
So this is a new program. It's called the New York Health Equity Reform. It was designed through the what they call the Demonstration Waiver 1115. This waiver has put away a great deal of money to create what I like to call a new Medicaid. So as we know, Medicaid basically pays the bills for people who are members of Medicaid, and mostly medical, some behavioral, some mental issues, but it's basically about paying the bill. And one of the things that they want to do is try to look at new ways that we can make people healthier, so that way the cost in the long run is less for the state.
Well, that's good.
Right? I mean, saving money is always a good thing.
Oh, yeah.
We want to also, though, ensure that by saving money, we're not hurting people. So what happens with this program is anybody who is currently a Medicaid member is screened against certain health equity problems, or what we call health-related social needs. Some people also call it social determinants of health. And these are issues that impact people's lives and create health issues. We can talk about it in terms of poverty, food deserts where there's no access to decent food, especially in the where a supermarket, let's say, is not available to people. So they have to pay more money, and they're not getting less quality for the food and less nutritious food options, or they have to go in and eat basically junk food. So, and then there's other things like incarceration, mental illness, redlining, other social ills that have plagued especially certain neighborhoods and certain groups of people. And we know that their health outcomes have been poorer. For instance, black maternal health, we know, is a major problem. It's triple what the normal death rate is in maternity. We also know that hypertension is a huge factor in the black community, especially, but throughout society, and that diabetes is rampant in our society now. With obesity, etc. Mm-hmm. So these are all things that are causing people to be less healthy, causing them to have more medical issues, and thus costing the state and the government more money to support them in the long run.
Yeah. So
if we can do something now to increase the likelihood that they will live a healthier, longer life, and a more fulfilling life then, and taking it to the spiritual level, obviously, if you're happier, your whole being is better, and your spirituality is embraced more.
That's true.
So if we can make them, not make them, but help them to live better and healthier, then we're going to accomplish two goals. We're going to increase people's happiness and their health, And then we're also going to make sure that the state has extra funds or isn't expending as much money in the long run
Well, so
to
they'll have
support them.
money for other things.
Exactly.
Yeah.
So we're looking at this, and they created this thing called the Social Care Network. And there are 12 of them around New York State, and they broke up the state. In New York City, there's 3 of them, really 5 because it's one per borough, but one company is running for Manhattan, Brooklyn, and Queens. Another company is running it for the Bronx, and here on Staten Island, the Staten Island Performing Provider System, which is a nonprofit which was started to help with health equity and other health-related issues about 10 years ago. We have been named by the state as the lead entity. But the beauty part of this program is it's not about one company doing something or one organization. We are a nonprofit. It's all about gathering the rest of the community together. So CBOs, 501c3s, health-related groups, even the local government agencies, to come together to form this network to offer enhanced benefits to Medicaid members. Now, you say, okay, well, what does that mean exactly? What kind of benefits are they? So it's designed to identify areas that have really impacted people's lives. So housing issues, okay? And I'll go more into detail on all of these separately. But food insecurity and nutrition issues. Then we also have transportation issues. So, and then the overall arching part of this is to have consistent long-term care management for people too. So it's bringing together all of these disparate areas and making sure that we're helping people in all of them as much as we can and based upon where they need the help, so that way they can live healthier.
That's good.
So one of the things is that we have contracted with many different organizations. Right now we're up to about 65
Wow.
Throughout Staten Island.
Just on Staten Island?
Just on Staten Island, this is.
What kinds of organizations?
So most of them are local community-based organizations, to name a few, Project Hospitality, Seaman Society, Chance and Life, and many, many more. And then some that are for-profit companies but are doing this because the services are only available through some of these organizations instead of going through a nonprofit for it. So we bring them all together and we contract with them to perform certain things. So the idea is that everybody who's currently on Medicaid gets screened once a year to make sure that we're helping them with their health-related social needs, or HRSNs,
That's
as
good.
they say.
So it's a once-a-year checkup kind of?
Basically, yes. And so the organization itself who's doing the screening gets compensated for it. So it's not like they're just doing it altruistically or through their own things. The idea is to make this viable in the long run so that these organizations can sustain it, right? So there is a fee, an hourly rate for them to do the screenings. And we call them screening navigators. They are really trained community health workers, which is a new field in the community-based work to make sure that people know about the different areas of help that are available to them, depending on their neighborhood and where they are in life at that moment and what their needs are. So this is an important new role in the community. Most organizations hire somebody. They'll change the name to Care Navigator or, in our case, a Screener Navigator. And their whole job is to go out and talk to the people in the community and to make sure that they're getting their needs met. So in this case, the Screener Navigator, the company is hired to do that, and they're getting compensated for the work. At the same time, if they're providing a service that is one of the enhanced services, which I'll go into further in a second, they also get compensated for providing that service. So we're helping the community in two ways just by this program, because we're supporting our community-based organizations and businesses by providing these services and the ability to go out and talk to the people in the community. And then also the community itself is being helped because now they have more services available to them, and they're more aware of what's available to them, so they can take advantage of things that'll help them live better lives. So then there's the second part of it where there's service providers.
Excuse me.
Sure. Service providers who will provide these enhanced benefits, and they're getting compensated to do this work. Now, some of it, can only be done by maybe a for-profit company or a combination. So we're looking at any companies that can do this or any organizations that can do it. We have contracts with them to provide these services. And the services have to be provided on a timely basis. And then once the services are in place, there's a checkup on it. So it's constantly being monitored. And then the people who are receiving the services can come back, and this is where the continuous care management portion of it comes in. They can now come back to the organization and say, whoever screened them, and say, hey, I had a change in life. I got pregnant. I, had to move out of my apartment. So maybe there's other ways we can help them so they can be rescreened. And every year then there's a rescreening to make sure that they're getting the help that they need at that moment in life. So, and then this goes on and on and on. So like I say, I like to call it the future of Medicaid, because it's no longer just about paying a bill. It's about really helping people now to live better so that later it's not costing the state as much and they have a more fulfilling life.
Sounds like a good idea.
I think so too. I think that the state actually came up with a good idea. And the idea behind this is that every different SEN throughout or social care network is on their own to develop this. So I'm very proud of us here on Staten Island because we are leading the state right now in the development of these programs and also being very, very innovative in our approach to it. So some of the services that are being offered through this are in the three major areas, like I said, in housing, food, and transportation. So transportation is a fairly easy one to talk about because it's just straight up, if somebody, and we know that transportation here on Staten Island can be a little difficult, right? If you have to go onto the other side of the island, you may have to go to St. George to catch a different bus or the train. It could take hours. I was talking to somebody recently about they lived on the South Shore, but there was no direct way of getting to Amazon, and they had a job at the Amazon facility.
Oh, boy.
It would take them over an hour, and they live right on Staten Island. It was only, like 8 miles from their house.
It took me to get to the city when I was working in the city.
So yeah, so it's a problem, and it's only going a few miles, and it takes you all this time.
Yeah.
So the transportation to get to services that they need, now you can get a voucher through an Uber or Lyft voucher so that they'll take you to these places at no cost. So Accessoride is a separate service that's offered by the city, but you still have to pay for that.
Oh, yeah,
So,
I think you pay whatever you pay on the bus.
exactly, the $290. But this is totally free, paid for by the state. And that's, I guess, let me make sure that everybody understands that. These are free services. It doesn't cost the individual anything. It's all provided, the money is all put away to support this program. And it's not impacted by any current cuts or legislation that's happening in Washington. It's all protected for a 3-year period while we work out the kinks and make this happen. So the transportation's fairly easy. You have to go to a service provider that you're going to get services from, or you have to pick up something. They'll pay for that. The other portion of it is the housing, which there's several different aspects to it. One is the pre-tenancy or housing assistance, meaning getting housing. So let's say you're unhoused, okay? For whatever reason, you don't have any place to live. They will help you find an apartment. They will pay 6 months of rent for you to get established, and they'll pay that directly to the landlord. We talk about Section 8 housing, et cetera, where it's paid for too. It's similar, but not the same, because there are certain criteria that you have to meet to get this benefit. Then there's tenancy help. So even if you're just trying to find someplace to live, you're in place, but you have to leave, they'll offer services through a housing organization that does housing to help you find something and then help you with the bills. So maybe they'll help pay utilities for a few months. Maybe they'll help pay the rent for a few months to get you established, get you stable.
And how do you go on and take care of it yourself after that?
Well, so that's the second part of it, which I'll discuss in a minute, about what we're calling level 1 services. So the enhanced services that are directly offered through this program, through the social care network, we'll call level 2 services. Okay, so they're the enhanced services. So things like housing help, right? So that'll help you get established. But then there's level 1 services that'll help you further. That's where you can maybe get into Section 8. Maybe you can get onto SNAP benefits. Maybe, if you're pregnant, get on WIC, so you get those benefits. And then also the navigator, community health worker, will also know what's available locally to you. So they'll direct you and make referrals to those specific items that will help you. So maybe you need help paying the rent. You don't have enough money from Social Security or from other sources of income. So they'll help you then find other ways of paying it, or find you a better, different housing situation that'll cost less. Then there's other things that are really related to the health benefits here. Things like, and we're calling them remediations. So let's say you have mold in your home. We know that mold is a terrible problem.
Sure.
It causes so many other problems, especially asthma, breathing. It can have mental issues with the way it affects the brain.
Oh boy.
And then causing all kinds of other health-related problems. So one of the things that this program will do is hire a company to come in and fix the mold problem in your home. So you're going to be healthier because of that.
Right.
Maybe you have a pest infestation.
Right.
Okay, they'll come in and help you with that. And they'll pay for continuous service to make sure that that's maintained. Again, we know that rodents can carry diseases or, infiltrate and cause problems with food waste,
Sure.
etc. So these are things that, are not obvious, but sometimes to people, but really have a deep impact on health. And then there's asthma itself, which we know, a big part of the population suffers from asthma-related problems.
Yes.
So we call it an asthma box, where they bring an asthma kit where they have different things like filtration systems. They'll install an air filtration system in the home. They'll also help with making sure that if there's problems in the home related, that they're corrected. And then, some of these things will need, what they call an attestation or a doctor's note, basically, to prove that there's an issue. But once that's all straightened out, now this company is hired to take care of these things. There's also things, maybe you like to cook, but you just got a new apartment, or maybe your refrigerator broke. So they'll give you a new refrigerator, they'll give you a microwave, they'll give you kitchenware, like maybe you need pots and pans. So how can you cook your own food if you don't even have pots and pans?
Right.
Right? And again, we want to make sure that you're healthy, especially through eating, and that brings us to the nutrition side of the social care network. It's to provide healthy food and get away from people having to eat fast food or sugar-laden food or salt-laden foods. And we know with processed foods, that's a horrible situation. So they will, if depending on how these questions, which I'll get to in a second, what the questions are about, if you answer certain of them, you can get a pantry box, which will include proteins, meats, etc., delivered weekly right to your doorstep. And then you can make your own meals and do what you want with them. But you'll also at the same time be receiving nutrition counseling and instructions on how to make the meals that are being delivered. So if, let's say, it comes with a pasta and sauce and maybe some ground beef, it'll have a recipe in the box for what to do with those items. So you're not just out there by yourself. It'll also supply some staple things like butter, milk, and oil, cooking oil, and olive oil, etc., to make these meals. And also some spices. But then there's also what I find to be one of the biggest benefits is prepared meals. So these are meals ready to eat, which are clinically and medically tailored to you, so that you're making sure that you're getting the healthy things that you need based upon your medical history. So let's say you have a history of diabetes. Well, we're not going to give you very sugary foods in there. You're going to get good, healthy, balanced meals. And they are microwave ready. You throw them in the microwave and you heat them up, and there you go. And you can have these delivered to your home, 21 meals a week, delivered right to your doorstep. One of the beauty parts of this is we're being very innovative with it here on Staten Island. And right now, we're launching on what we're calling refrigerated boxes. So everybody's seen the Amazon boxes around in neighborhoods, especially in the NYCHA homes, so that people, sometimes they won't go up and deliver it. They're afraid of the porch pirate situation. So the same thing here. You're going to have those meals, pantry boxes or the prepared meals, to put into a refrigerated storage box, and you can go and pick it up at your leisure, and you don't have to worry about the delivery then.
Pick it up where?
Out of one of these boxes that'll be set up.
Boxes.
Yeah, so
I see. In other words, the box will be there, and they'll just hand you the food.
Well, you'll go up, you'll have an app on your phone, and you'll know which box is yours, and you'll plug it in that you're here, and it'll be facial recognition or a code that you have to put in, and it'll pop the box open for you, and you take your bag and go on your merry way.
Wow.
Something that's never really been done before. It's been tried in a few places very successfully, so we're going to be the innovators here in New York State with it. Offering it for the first time for these kind of deliveries.
What will they think of next?
Right?
Is that similar to the Meals on Wheels?
In a way, yes. Meals on Wheels actually is going to be one of our partners eventually in this too. But so they deliver it on a daily basis. This is delivered on a weekly basis. Way, it's cost savings there along the way.
Oh, I'm sure, yeah.
So you're getting everything at once instead of it having to come every day or every other day kind of thing. And the variety will be much greater. And eventually the plan is with these providers is that you'll actually even be able to pick the meals you want.
Wow.
And they're culturally sensitive. So you're not going to get something you're not going to eat. You're going to have the option. There's a questionnaire that they ask you to make sure that you're getting what you like and not just
Like
anything.
if you don't like Chinese food, you don't have to.
Exactly.
Yeah, there was a time when Italian food was unheard of. And I think it was Chef Boyardee was one of the ones that kind of brought that to people's attention.
Absolutely, yes, on a mass scale.
Yeah.
And well, we are much more cosmopolitan in our eating habits now. Some people still just don't like certain things. And then there's people who are vegan or vegetarian or pescatarian, so they'll take that into consideration too.
What's pescatarian?
They don't eat any meat, but they'll eat like fish.
Fish or chicken or something?
Yeah, not chicken, but fish or shellfish, shrimp, things like that.
Right.
So it's sensitive to the needs of the individual too. So, and especially culturally, like I say, because some people like certain flavors, certain spices, etc. Some people like things hot.
Yeah, not me. Not me.
And it's being fair about that. But this is a new way of looking at delivering food to people.
Yeah.
And getting them nutritious, healthy food.
So when will we see these boxes?
The contracts have been signed, and they're going to start going up in West Brighton. Actually, is getting one. Probably within a month, they'll be operational.
Wow, hot stuff.
So yeah, just really, really innovative thinking, and that brings us back to the point that I wanted to say that I'm very proud of our organization because we are leading the state in here. We have the most per capita people who have been screened so far in the entire state. We have also been innovative in the way we're approaching this, and we have the most people already getting services. Over 2,000 individuals are currently receiving meals or pantry boxes delivered right to their homes on Staten Island.
Wow.
So Staten Island has a population of about 500,000 people.
That's right.
There are 1/3 of the people on Staten Island, believe it or not, are somehow affected by Medicaid. Approximately 180,000 people
Wow.
are Medicaid recipients or Medicaid adjacent, because sometimes there's different flavors of Medicaid. So, but the people who there's 130,000 people who are eligible for these benefits. So this is huge. You know, it's going to impact so many people. And the whole idea is that to prove that if this works, then it's a new way of looking at helping people, right? You're not just paying the bill, you're helping them to be healthier and live
Making
more
their
fulfilling
lives
life.
better.
Right. And so I think it's a huge, important process that we're going through. I think it's a wonderful way for the state to be responsive to people's needs. And again, it's all over. And the way this all works, it's a very simple process. It's all data-driven and technology-driven. So you can either do it live with somebody from one of our CBOs. So like I was saying, a local organization can get contracted to be a screening organization or a navigating organization. So they would actually contact, and especially the people who they are already servicing. So let's say you're running a pantry. Well, you have all these people who most likely, a great deal of them are on Medicaid. So are Medicaid members. So hey, let's talk to them. See what we can do. Just think about it. If now they're getting meals, they don't need to go to the pantry.
Well, that's true.
So that whole
That'll cut
business
down
will
on
go.
the lines.
Yeah, right. And but it'll also help people then in the long run, because now that money can be diverted to offering other services. Pantries spend a lot of money, and companies donate a lot of food. So, you know, City Harvest, thousands and thousands. The Food Bank in New York, thousands and thousands of dollars, millions of dollars, going to purchase and supply and move that food around. So that money can go to other services that people need. Along those same lines, you can say that the organization that is helping their individuals are now offering them something different. So it's another way to help your own memberships and your own constituencies. And I'm very interested, and I've been talking to a lot of faith-based organizations, and churches, the organizations that are working with different religious groups, across the board, to be involved in this, because where are people congregating? At church, right?
Yeah,
at the
that's true.
synagogue.
Yeah.
At the temple.
Whatever.
Wherever. So they're there. We can reach them right there and make sure that they're being serviced by this program. So we're very excited about that too. Matter of fact, you probably know them. New Hope Church in West Brighton, right down the street. On Alaska Street there. They'll be participating. I was just talking to them this past week. But it's not just them. It's, we're talking to Catholic organizations. We're talking to, the Jewish organizations. The JCC has joined us to do this work. So it's across the board. And we really feel that those faith-based organizations can have a real impact, because they're going to be the ones who talk to the people there, and they have the trust of the people.
Right.
One of the biggest things with this, it's kind of a funny aside, was that when we first started doing this in January, and it was just a small cadre of people making the calls and all, people were thinking it was a scam.
Oh, God.
So because it was
you
something
never know
new.
nowadays what's a scam and what's not.
And this is so new that nobody had heard of it yet. 6 months in, we're still, that's my job, is to get the word out, to make sure that people in the community are aware of this program, and that the organizations who are getting involved in it really understand it. So, it's the first couple of calls, I could hear I was sitting in on a few of the calls with the screeners, And it was a few people were just, I don't want, no, this is a scam, and I don't want to be involved in this. And so you have to really think about to make sure that you're gaining the trust of the community. And we all know that, especially in nonprofit work, that's the key.
So if the churches and temples and whatever let their congregations know what's going on, they'll be more apt to be receptive.
Correct.
Yeah.
Correct.
Yeah.
So, and it's all about trust. So,
Yeah, sure.
And that, people are kind of hesitant to say, yeah, you're going to do this for me.
Right. You can't blame them because there's so much going on.
And,
Can't even answer your phone today.
I don't even have a home phone anymore because that's all I was getting was
I get it a lot
scam calls
too.
and stuff. So I finally said, that's enough of that.
Yeah.
And I wasn't really using it for calls much anymore anyway. So it was more as an emergency thing, and that even those reasons you don't really need it anymore.
Yeah.
So, but
maybe I should take my phone off and save some money.
Exactly. That's that's what we did. We eliminated that from the plan. So I'm just very excited about all of this, that we're bringing it to the community. We're, actively engaging individuals, and that, like I said, the impact could be huge. There's, like I said, 130,000 people who could eventually be getting these benefits.
Well, that's good. It's gotten to be where there's no reason anybody should be going hungry on Staten Island.
Nope. As you know from our previous conversations, I was the former chair of the Staten Island Hunger Task Force. So I, and ran a pantry for 5 years directly. So I'm very, very aware of the situation on the island. And if this program can help alleviate that problem,
sure,
and make people healthier at the same time, I think it's a
then
very
you did
valuable
your job.
work. Yeah, exactly. That it's really been a useful endeavor.
That's good. That's good. Tell me, you mentioned that some for-profit organizations would be involved. What kind of organizations?
Mostly on the home remediation front, because not too many nonprofits do that kind of work. Pest control, or
those kinds of for-profits.
So there is, but the reason why we call it health equity is, one, we want to make sure that we're hitting the populations and the neighborhoods who really need these services, especially. And we know that, targeting them a little bit, that we know. People in NYCHA houses, most of the time they have problems with food equity because they are in a food desert a lot of times. There's no good supermarkets around. We know that sometimes transportation can be an issue for them to get places. We also know that, just food insecurity has plagued that community for a long time. And again, what we call the food deserts, but also that a lot of times, especially now with, where you just order up any food, but how often do you order healthy food? You're getting the burger and the fries, or you're getting a pizza. And, you're not ordering a salad. I mean, some people do, and
a lot of people eat salads.
But a lot of times they're not. A lot of times they're just, and especially the children, are just eating junk food.
Yeah, or they like their macaroni and cheese.
Right, which personally, I love macaroni and cheese,
love macaroni and cheese.
But it's a real problem to get healthy food to people. So, we have to be honest with ourselves too. That if this is something that we can do, then we have to try. And obviously, there's a real need for it out there. The pantries have actually exploded on Staten Island.
I know.
The lines have gotten longer. The number of people being helped. I was talking with an organization just the other day, and they're servicing twice a month. They're servicing nearly 300 people.
Wow.
In their pantry, and it's a full service pantry where the food, but also household supplies and things. So
that helps.
Yeah, and they're crazy because, and that's one of the things with this too is, let's make sure people are spending money on what they need. So it's not just food. So if we can give them healthy food, now they can buy the stuff they need to also live healthier.
Yeah.
Cleaning supplies, better furniture, different ways of living better and cleaner and healthier. So I do want to touch base because I kind of got off track a little bit about it, but there's a huge area that we need to recognize in this, that those level 1 services are so important because people don't know about them.
What's level 1?
So level 1 would be things like SNAP or WIC. These are services offered by the government that people aren't taking advantage of, that they could be because they qualify, but that some people don't even apply. There's other things like, especially in workforce development, there's tons. I was just talking to UAU this afternoon about their workforce and their CDL training programs. So here's a beautiful paid, you get paid to take the training, to get a high-paying job driving a truck or a bus. And so many people don't even know that these things are out there for you. And these are financed by the government or by private individuals or, grants. And there's all kinds of training programs out there, especially now in the green sector, and the climate control area, or in the energy efficiencies or different energy markets. They want to build that big area on the West Shore here for staging of the wind farm stuff, so that the ships will come in, they'll assemble all the wind turbines here, and then take them out into the harbor, or actually, way out, and set them up. And these are huge, high-paying jobs that our community can take advantage of.
These wind things, though, are they dangerous for the birds?
No, not at all. Not at all. Most of these are set up off the coastline. So they don't, very little, environmental impact. And they've been used now all over the world for many years. So they know that they're safe and reliable. And they're not sitting in your backyard either. You're off the coast. So it's not, most of them you don't even see from the shoreline. So you don't even know they're out there. So, but, this is a huge moneymaker for companies to get in here. So workforce development efforts are really big right now. I was talking to you briefly earlier about some of the changes to Medicaid and what they do. And so one of those is the work requirement. So in another year, all of a sudden, we're going to have a lot of people losing benefits because they don't meet the work requirements. Well, we have to ramp up now to make sure we're helping them to meet those work requirements. And work requirements aren't just that you need a job. You could be in a training program, you could be volunteering, you could be in an internship, you can have a part-time job, a full-time job.
In other words, work for what you're getting.
Exactly. And there's nothing wrong with that.
And, it's also good to give people that work ethic.
Exactly. But we have to start somewhere. So we
That's
have to
right.
have the training available to get them the jobs.
Right.
And so we can help them with what's currently out there now. So those are the level 1 things. So a screener navigator will be talking to somebody and say, oh, well, I need a job to get off Medicaid. Okay, let's get you in a training program. So, we know that, this organization provides training. You want to be a truck driver? Sure, I'll do that. Well, now you go through a 12-week program. You learn how to drive a truck. It's all paid for, and they're giving you a stipend to help you live at the same time. And now you got to, and some of these, there's such a demand for drivers, especially bus drivers, that you can get a job right out of the box. Coming out of training, and once you pass your credentialing with the state, of course.
Right, of course.
But once you get that license, bam, you have a job. So, and these are programs that are currently existing to help people. So this program that I'm talking about, the Social Care Network, isn't just about the 3 main pillars of transportation, food, and housing, but it's also about giving opportunities to people in their own communities to improve their lives and taking advantage of these. And again, the economic benefits will be huge down the road with this kind of an attitude towards it. So it's a different mindset. It's not about just paying the bill and helping after the fact. It's about helping prevent the problem to begin with.
Yeah, that's good. I hope it works.
Well, so do I. And I mean, there's been a lot of research in a lot of these areas related to the social determinants of health, they call it, that it really helps people live better. That if we solve some of these problems and help them solve their own problems.
I'm sure, especially people that are willing, because there are people that really aren't willing. They just want to collect and that's it. You got them among them.
Well, there's always those people. I mean, I was talking to somebody the other day about it, and I said, well, they were talking about abuse, and I said, in retail we had I worked in retail for many years, and it was called the 5% rule, that you were going to have 5% loss.
Shrinkage.
Right, shrinkage. And as long as that, you knew about it and it was controlled, well, you're going to have to live with a little bit of fraud, a little bit of abuse. It's the way life is. People, the human is, a devious person at heart sometimes and is always looking for that shortcut.
Yeah.
So, and we have to be honest about it, that's how it works sometimes. So, but as long as it's not too much.
Well,
and you have
true.
to set those limits.
You have to, yeah.
And you have to have the safeguards set up. And one thing about this is there are safeguards set up, so the abuse will be very hard because built into this system is checks and balances. So when somebody is offered a service, the organization that's providing that service has to respond in 5 days to contact that person. There are requirements for delivery that they have to do it in a timely basis. So you can't say, oh, well, I'm going to do this next year. No, it's like, this has to be done within a month kind of thing. And then there's checks and balances. They have to report back to us. And if they don't complete it in the allotted times.
You're talking about the recipients.
The service providers. So the companies or organizations that are doing the work, if they don't live up to the expectations that in the guidelines, they don't get paid. So they're economically stimulated to do this the right way. And then there's checks and balances where we have to check on 10%. Built into this whole thing is that we have to go out and check personally on 10% of the work that's being done to make sure it's being done right and to make sure that it's actually benefiting the person correctly.
Oh, sure, you have to supervise.
And solving the problem. Yeah, so, they realized early on that abuse could be an issue here and that companies could just be lying and,
that's for sure.
faking it.
And it happens.
Oh, certainly does.
Happens every day. The companies fudge things, to get more out of it.
So,
Well, what would happen when you came to the conclusion that a company is doing that? You cut them off?
oh, yeah. They would immediately be ejected from the program and legal action would be taken to remedy
That's
it.
good.
So that's part of the contract. It clearly states that when they sign that contract with us, the lead entity, that they have to live up to the expectations. And like a service, if the service advisor is a screening company, if we're paying, because one of the beauty parts of this is that we'll pay the salary of the person to do the work if you're a CBO or a nonprofit. We can help pay the salary for the person to do the work. But you have to live up to the expectations. We're not just going to say, okay, and then, they only do 2 screenings a day. There's expectations. And,
Right.
There's guidelines that have to be upheld. And if they don't live up to them, they'll have that person taken away from them or that funding taken away.
Yeah.
And we'll give it to another organization who really wants to do it.
Right.
And, that's part of the economic incentive here is that, we're not just helping the individual who needs help, but we're helping the organizations in the neighborhoods that are doing it so that they're reaping benefits from it too. But they have to live up to the expectations just like anybody else.
No, that's good policy.
Yeah, I think it's a very well-crafted situation, and the way this whole program was designed. The biggest problem is that it's a short timeline because we have to prove and get to everybody, in 3 years.
Wow. Do you think that's not a lot of time?
Well, we're hoping that, especially here in Staten Island, that by proving that it can be done and done well, that they'll do an extension to it. And if that works, now we have, and especially the rest of the state has a little more time to ramp up properly. It's a big undertaking. It's a very complicated,
Sounds that way.
thing, but the benefits can be so dramatic. And especially, with any other issues like we talked about, with Medicaid changes and cuts, et cetera, we're going to need to find different ways of helping people and really get them away from these programs so that they aren't dependent on them.
Yeah.
So, and that's where the workforce development especially, but also offering, the idea that, some of the groups that are automatically covered by this too is an important aspect to look at. People with, diagnosed mental disorders, substance use disorders, people right out of incarceration, we know, and that have chronic health conditions, people who have chronic health conditions that are known, and what we call the frequent users, okay? Like maybe in a rolling 12-year period, they've been in the hospital more than twice. These people we know need more help, and that they need to live healthier,
Twice
or else they're
for
just going to get
drug abuse and things like that.
yeah. So and that's where those level 1 services come in again, where we're going to make sure that they know about other services that are available to them. Maybe Camelot, or at the hospitals. The opioid providers. Opioid services to get you off opioids, etc. And the heroin clinics, etc. So there's other services out there that people can get to help them with their problems too, and that's what we want to make sure. Maybe it's a behavioral health issue, that they're having.
Are they all associated with your?
Yes. So the idea behind the social care network is the core is the Medicaid member right now, right? Now, and this idea can be extrapolated to society as a whole too. But right now, it's the Medicaid member. Then it's the social care network immediate. So us as the lead entity and all the contracted providers. And even, some of the contracted providers are doctors' offices. Because who are they dealing with?
Right.
Patients who maybe need these services.
Well, they would come under the for-profit people.
Some, yes. So, and they would be the screening, and they would get compensated for doing those screenings. The hospitals are an important part. So when we're working on, so anybody who comes into a hospital is automatically checked to see if they were on Medicaid. If they are, then they go and get screened on their discharge, because maybe they have a chronic health issue that needs addressing. One of the beauty parts of the populations that we're really trying to help too is children. So anybody who's in kinship care,
and there's lots of them.
foster care, or has any kind of a medical problem, automatically covered by this. Any child under 6 or 6 and under is automatically covered by this, because we want to make sure that they're getting the nutritional and coverage that they need to live healthy, especially with things, we can go back decades to talk about lead poisoning, right?
Oh,
in the
yeah,
paint,
definitely.
which was a huge issue. Well, nowadays, that's mold. The mold is the new lead.
Wow.
Because it has such dramatic effects on people's health. And we're only really scratching the surface on some of these things, that we don't really understand them as well as we should. But we didn't know it was a problem. Asbestos, things like that
Yeah.
we found out or have such dramatic effects on people.
They used to use asbestos to spray fake Christmas trees with snow.
Can you imagine, right?
Henry Winkler's got this show on talking about all the dangerous stuff that they used to do, especially with toys.
Yeah. So we didn't know.
Yeah.
You didn't know until the science found it out. And then once the science found it out, we had to react to it.
That's right.
And we're doing the same thing here with on a bigger scale with these health-related social needs, as opposed to, an individual thing. But some of it is, like with asthma, that we know asthma is a major problem. So we have to address that by helping people to have cleaner, better air. Plain and simple.
And the right medicine.
And the right medicines, yeah.
Yeah.
So, and that's the whole care management portion of this, is that it's constantly evolving, but we're also looking at, making sure, one of the people that is anybody who's in a health home. So a health home is it's not an actual home. It's where they know that people have multiple problems So they're covered under a program called Health Homes, where there is a cooperation amongst the different providers for their problems, so that they're being treated as a holistically, as a whole person, not just as this doctor's treating this doctor's treating that, this doctor's treating this. It's about making sure that all those doctors know what they're treating and at what the other doctors are treating.
Right.
So especially with drug interactions, that's eliminated, and maybe there's a course of treatment that would be adversely affected by another condition that the person has. So this is supposed to balance that. So anybody in those kind of situations also in the automatically accepted into this program.
Sounds really complicated.
It is, but it's also giving jobs to the community as community health workers, screener navigators. It's creating, a whole new sector for nonprofits to make money and to support their other programs. And then at the same time, it's in the long run helping people live healthier.
Yeah, well, that's the goal.
Absolutely.
Those are all good goals. To help people to live better, live longer, live healthier. Yeah, it's always.
And I think that treating that whole person is very important because, as your show is about spirituality.
That's
and
right.
When people are healthier, happier, they're more spiritual. They're helping their neighbors. There's a that go around, that full circle.
This is a very spiritual conversation we're having. Definitely goes with the show.
Good. Well, I'm glad. And I thought it was, my main goal was just to get to as many people as possible. And, knowing you and being on the show before, we're talking about food insecurity and issues. I felt that, your audience would be very receptive to this. And
well, I hope that people who would benefit by this would be among the audience.
Absolutely, yes.
But
it's also word of mouth, because when we're talking about somebody on Medicaid, it might not be you, but it might be your aunt or the kid next door.
Right.
And you never know. So you could be, just by knowing about this and communicating it to somebody else, you're doing the spiritual thing by helping your neighbor.
Yeah.
And this is what it's all about. It's helping your neighbor to live healthier.
Yeah. Well, and basically, might as well say, all humanity are our neighbors.
Absolutely.
Absolutely. Everybody's our neighbor.
That's a beautiful way of looking at it.
And we're all connected.
Absolutely.
Yeah. Yep, that's the way it is. In the meantime, so anything more that you need to add to this?
Just that to get involved, you can go directly to our website for the Staten Island Performing Provider System for Social Care Network, which is Staten Island PPS, Staten Island all spelled out, and the letters PPS.org. And there's a screening tool right there so you can enter your base information, and then a screener navigator will get back in touch with you and start you through the process. You can inquire at, we're going to be hitting a lot of pantries this August and September to make sure that people who are going to the pantries know about it. Mm-hmm. We're also going to be hitting the senior centers. To make sure that they're aware of it.
And we're putting out flyers and stuff?
Yes, and communicating it. I personally go to almost every community event that's happening. I'll be at, there's the Cy-Pop Game Day down at Colonel Thompson Park in West Brighton tomorrow. I'll be there handing out information and sunscreen. So, it's to get people to know what's going on.
Right. That was Staten Island PPS.org for people who would like to volunteer.
Well, to actually sign up to be screened, to get the benefits. Right. And then along that same site is, if you want to be a provider, maybe you're working for an organization in the community and you think that this would be, helpful for your organization to be part of, you can sign up there too. But then, like I said, we have 60 some odd, 65, I think at last count, organizations already contracted. So
Well, that's wonderful.
there's a lot of organizations. There might be one in your neighborhood. So if you see them talking about this, we also want to go out to the churches and the
Yes.
synagogues, etc., and talk to the congregations
That's good.
directly. You know, maybe set up a table outside after the services are finished.
Right. Well, this is all wonderful stuff, and you've really, really given us a big background on what's happening. And I hope that many people will benefit, especially after the show.
Absolutely.
In the meantime,
We'll see if we have an
up.
uptick in enrollments.
Yes, let us know. Anyway, but in the meantime, thank you for coming and doing this. This was wonderful, and I hope it helps. I really do.
Well, we've known each other for a few years, and
That's
I know
right.
the wonderful things that you do in the community and to help others, especially through this show. But in your active daily life too, I know that you're very spiritual and you're very much involved.
Yes, thank
So
you.
I've always admired that, and this was just another wonderful opportunity that I could have to.
It was a good
help.
opportunity for me to use the show for something really good.
Thank you.
Thank you. Good night, everyone.